everyone to today's session, Scanxiety, Navigating the Cycle of Anxiety Around Imaging and Appointments, led by Ben Pierce and Mackenzie Cordova. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the social work team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the Q&A feature throughout the session. At the end of the session, your questions in the chat will be used to moderate our question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass this session over to our panelists, Ben and Mackenzie.
Thank you so much, Sierra. Hello, everyone. Welcome to today's Scanxiety workshop. Once again, my name is Ben Pierce, and I'm a clinical social worker supporting the Neuro-Oncology Clinic at Dana-Farber Cancer Institute. And I am joined today by my colleague, Mackenzie Cordova. We are presenting on a nearly universal topic among the patient population at Dana-Farber Cancer Institute, and also one that applies to the greater cancer patient population outside of Dana-Farber, both for those in active treatment and for those in medical surveillance. This is the first time in recent memory that we dedicated a webinar to this topic, and we are hoping to refine the presentation over time for future sessions. So we will make some time for questions at the end, and your input would be highly appreciated. When we get the presentation going, we're going to start with some general symptoms of anxiety, effects of anxiety on the body and other processes. We're going to move to some strategies for managing scanxiety and close out with some commonly asked questions and ideas for the future. For those who are looking at the first slide right now, that's the character anxiety from the most recent Pixar movie Inside Out 2, which is as emotionally devastating as you might think it is, but it's also a wonderful movie. I just wanted to give a quick plug for that one. Mackenzie, other thoughts before we roll out?
Yeah, thank you for introducing that anxiety character. Such a wholesome and also devastating movie at the same time. Great for normalizing our emotions. But just wanted to give a brief disclaimer here before we jump into the presentation. We're really going to try to paint a picture today of what scanxiety often looks like, both in the work we do as social work with patients and what you all might be experiencing in real time. And then while we recognize that many of you here might share the experience of a cancer diagnosis, we also want to acknowledge the variety that we have within today's crowd, and that today's presentation may not encompass every experience. So each cancer journey is incredibly unique, and we encourage you to take what feels helpful from today's presentation and leave what does not, with the knowledge that you can always connect with your care teams and, of course, social work or other supportive providers here at Dana-Farber moving forward to further discuss your individual treatment experiences, including, of course, scanxiety. So just wanted to give a brief kind of acknowledgement to the variety that we may have in the crowd today, and we're happy to talk more, and I'm sure the whole social work division is welcome to talk to you more about what this might actually look like in your life if you don't see your entire experience captured today in our presentation. But I think we'll go ahead and jump in from now. We're going to start first by painting a picture of what anxiety may look like more generally before we go into the specifics of scanxiety. This is just to better kind of paint a picture because much of scanxiety and anxiety symptoms actually overlap. We just see scanxiety being a little bit more on the specific side. But when we're thinking about anxiety, what we're typically talking about is a generalized anxiety disorder experience, which is persistent and excessive worry about all the broad variety of things that happen in our lives as humans, those events, those activities that come up and cause us stress and anxiety. And while a degree of worry is, of course, normal, as a human, we all stress or worry about things. When we're thinking about really anxiety, what we're thinking about is an interference in our functioning, which is often kind of presenting in two specific ways in our mental health and then in our physical health as well. As far as mental health symptoms, these are often caused because anxiety triggers an uncontrollable feelings of fear, dread, or uneasiness. And so when we're experiencing these things in a really persistent way, we often notice mental health dysregulation in things like increased irritability. So that might mean like anger or annoyance or loss of tolerance with people in your life. We might also have like a heightened startle response. So thinking about even just someone coming and placing their hand on your shoulder, and you're on edge a little bit more. Things feel a little bit at the edge of your nerves. We often really come and see a difficulty concentrating as well. This might be concentrating on your work. It might be difficulty concentrating on your routines, whether that's in parenting or self-care or just generally going about your day. Can feel hard to really bring your focus back to the present. We'd also often see low mood, and this does not mean something necessarily like depression, but certainly feelings of sadness and just feeling like you're down a lot. And this might be because when you're in that space of uncontrollable fear, dread, uneasiness, your mental health is just really strained. And it takes a lot of energy to be in a strained mental health space. And so it doesn't leave a lot left for our brain. We're tired at the end of that. We might have some low mood. But despite sometimes that our body and our mind feel tired after being in such a stressed mental space, anxiety unfortunately doesn't always let us relax either. We might not be able to stop our brain, might be in a space of rumination, and it's difficult to relax our mind despite even feeling tired based off of how our anxiety has been in a day. On the opposite side here, we've got some physical health symptoms. And when we're thinking about physical health, what we're really talking about is your body's response to the stress that anxiety puts on it. This often manifests as headaches, muscle tension, your shoulder tension, your jaw tension, racing heart rate, because when our body is stressed, and our mind is stressed, our body certainly responds to that. It also might look like restlessness, shaking, tingling, twitching in our body, just a feeling that we can't settle down. Or, of course, going along with that racing heart rate, our shortness of breath. Our body just gets in a really kind of consistent state of dysregulation. And so these are just some kind of general things to keep in mind. These are general symptoms of anxiety that certainly present when we think about scanxiety as well. But I'll hand it off to Ben, who can talk a little bit more about the unique scanxiety experience and how that's a little bit different than just generalized anxiety.
Thank you so much, Mackenzie. So scanxiety, a pun that's no fun. I apologize for squeezing a rhyme into the title card of this next slide. Scanxiety, that is a term that I certainly hadn't heard prior to my work at Dana-Farber, but once I started working here, I felt like it was everywhere. I think it's really something that's it's definitely not specific to the Dana-Farber Clinic. I think that it's a term that's been coined across the country, maybe even the world. But it definitely points to a unique experience for patients who are managing a chronic illness. I think that it's, like I said, a near universal experience for patients in any level of oncology care. And these are just some differences that set it apart from generalized anxiety disorder. So the scope of the anxiety is specific to scans and the impact that those results of the scan are going to have on treatment or medical surveillance. It is less based in body chemistry or previous histories with anxiety, though those things can absolutely impact your experience with scanxiety. They might make you more prone or more vulnerable to it. But there is context for the stress that you are experiencing, and the context is the scan. And for many patients, there is an aspect of medical trauma that is aligned with scanxiety. There are many experiences that are, by their very definition, traumatic when you are diagnosed or receiving treatment for an illness. And a lot of the scanxiety symptoms circle around those experiences. Unfortunately, clinics and hospitals can be very emotionally triggering, no matter how nice the staff are, because unfortunately, it's in these spaces that patients first learn about their diagnosis. And going back to those spaces can bring up associated memories and sensations, like a reliving of that trauma. So there is, I would say, an element of post-traumatic stress disorder and an anticipatory stress that comes with scanxiety. Another difference between scanxiety and generalized anxiety disorder is the duration. It's often time limited to shortly before and after scans. It's not as long lasting or as pervasive as generalized anxiety disorder. There's no set time limit. And this is, I should also mention, maybe at the top, that this is not what you might consider an official designation or diagnosis. You won't find scan anxiety necessarily in the DSM, but it certainly feels real enough for our patient population that I think it is an extremely real experience for people, whether it's been documented or not. Um, Other points I just want to bring up to this point. So as I said, there's no set time parameters for scanxiety, but the upcoming scan is the focal point of the anxiety. It's what the stress and anxiety kind of centers around. Um, Again, context. It tends to be more concentrated and intense in the last days leading up to a scan and the day of the scan itself. And the scan results can either bring relief or fuel more uncertainty and sort of generate more scanxiety. So we divided sort of the cycle of scanxiety into three parts. There's the build up to scans, which can be months, weeks, days. It's different for everybody. You might see low levels of anxiety in the months leading up to a scan, though it can spike when you're trying to make plans for later in the year, like trips, family visits, etc., because oh yeah, I'm not sure what's going to be coming down the pipeline with my scan results. So you might see some episodes of scanxiety, at those moments. Stress ramps up in the last few weeks before the scan, culminating in the night before and the day of. Um, and one thing about this phase of scanxiety is that typically it's associated with more mental and emotional anxiety symptoms, like those that Mackenzie reviewed in the last slide. Next, there's the phase during the appointment. Again, there are multiple spaces in the clinic that can be emotionally triggering. Um, and there's also a high potential for frustration due to delays. We obviously try to, oh, sorry, I'm just turning off my phone. Apologies, everybody. Sorry for that interruption. So there are multiple spaces in the clinic that can be emotionally triggering due to past experiences, as well as a high potential for frustration due to delays. We obviously try to control for delays at Dana-Farber, but unfortunately they do happen. And there's also the emotional tension of wanting an answer versus not wanting disappointing news. So that can be a difficult space to exist in while you're waiting for your appointment. This gets harder when there's an extra day that's needed for results, which can prolong the tension between the actual scan and the exam appointment. And for those reasons, anxiety symptoms during this phase tend to be more physical. You get racing heartbeats in anticipation of the results, restlessness from feeling stuck in the experience, shortness of breath, muscle tension, you're tensing up, etc. And then finally, there's the post-appointment phase. It's based on scan results. You can see a release in tension with good updates, or you can find further tension if the scan results are more challenging. The ride back is an opportunity for an emotional cool down, but can also be challenging if you are debriefing the appointment with family. And then, of course, you're also looking towards the future and when is the next scan going to take place? And that might happen as soon as you get in line to schedule your next appointment. You're already thinking towards the future. Um, and this here we see a blend of both mental and physical anxiety symptoms. Um, Excellent. So I am going to pass it back to Mackenzie.
Yeah, thank you, Ben. Going to provide a little bit more about what scanxiety looks like in treatment versus in medical surveillance, really kind of talking about the context around your scanxiety as an opportunity to understand how we can actually better control it. You know, when we know where that scanxiety might be coming from or what's going to be the quote unquote cause of it, we might be able to set the stage better for some mediating strategies, some things that can help us feel better. So when we think about the cause of scanxiety during active treatment, things that include chemotherapy, radiation, surgery, etc., scans are really a part of our monitoring our progress. We're trying to understand, is our treatment working? Are the steps that myself and my care team are taking for me, are those being effective? And so oftentimes, though it is not an overall statement, we do sometimes see that scanxiety can feel more like a greater intensity during active treatment. And that's due to a couple of reasons here. One, it's because our scans are usually happening more frequently during active treatment. Our care teams are actively monitoring at certain time points, and that will look different for every type of cancer here, but they're actively monitoring at certain time points. Is treatment working? Do we need to be making any type of adjustments? Really kind of checking that progress very often. And because we're having a greater frequency of scans, we're going to be put in that very kind of triggered anxiety space much more often than if our scans were spaced out. As we've mentioned, again, scans can be really consequential for treatment and surgery changes. So as we are approaching scans and the fact that we're having to do that more often, we're put more often in a mental space that might be thinking about possible changes, really feeling that lack of control, really feeling that uncertainty about what might come next, and that nervousness about what a scan can hold, because we want to know, are we going to have to make a shift already during this time of so much change in treatment? And that can be a really scanxiety inducing thing. Of course, we also are thinking about the overall context of what it means to be in active treatment. And that is a really heightened time of emotionality. That's not just limited to scan or to anxiety. It's certainly sadness, it's anger, it's uncertainty, it's all of these tough emotions that are coming to the surface when you get a cancer diagnosis and you're going through active treatment. And so we're thinking about your baseline there is not zero. You're not at calm always when you're in active treatment. Our baseline is often way higher than that. And we're already in a stressed state or an uneasy state. And so when we add a scan on top of that, that really can heighten our scanxiety intensity and make us feel things way more than we would, even if we were in surveillance or something like that. So just a little context around why scanxiety symptoms might feel more intense during treatment. But of course, on the flip side, for those who are here and in surveillance and experiencing this, just because scans are happening less frequently or you're in a space of surveillance does not at all mean that scanxiety doesn't happen. You know, just the very act of going in for a scan and having to monitor your progress can be triggering each and every time you go into it. And certainly later we'll talk about some strategies that might be helpful in mediating that. But we know that it's normal at every part after a cancer diagnosis, whether you're in treatment or in surveillance for long term. And this is often because when we're in surveillance, especially for those who might be months, years out of their active treatment, we give you a sense of normalcy back. And cancer will always be a part of your story, but we give you parts of your life back that might have been disrupted from it before. And you get in this space of normalcy and this routine that doesn't necessarily always feel super revolving around cancer anymore, at least in comparison to the way that it might have when you were in active treatment. So coming back to a space, whether that is the physical kind of building here, the scan, or even just the emotional space of coming for a scan, really kind of can be very re-triggering for those who have been in a normal space and all of a sudden have to come back to a cancer space and shift their mindset in that way. And so we can see intensity of scanxiety symptoms come up because of that, because we're forcing you from normal back into cancer, which can be a really hard shift to make. To provide a little bit more of an easier, kind of more palatable way to understand what scanxiety might look like in surveillance, Ben and I have kind of thought of this analogy here of checking the engine. And while scans during active treatment are more about checking progress, scans and surveillance are about making sure that progress is still working, and that we're still in a stable state. We're checking our engine. For those in Massachusetts or in our surrounding states, we might be familiar with that our cars have to get an inspection. And every year you have to go in, you got to pay your $35 and you got to get your inspection, and then you get to go on your merry way, ideally after that. But for those who might have had car trouble in the past year, had to check those brakes, had to check the engine, whatever that might have looked like. We know that when we've had problems with our car in the past, we might have a little bit more worry and a little bit more stress that when we're approaching that yearly inspection, oh no, what is that going to mean? Am I going to need more work on my car? And so we can apply that kind of sillier, but certainly similar mindset here to a scan experience, which is like, will I myself need a tune-up? When I go in and we check what's under the hood, will I need more work? Will something else need to be done here to make sure that I can stay in surveillance or to kind of see where my cancer is at? And that can be really hard when we've been in a space where our body has needed work and our body has needed attention over the last year. It's normal to be in a space of anxiety when we're checking our own engine. So while that's a little bit of an example given in jest and to try to add that more palatable approach, it really can be so hard when we've been in a space of normalcy to go in and bring ourselves back to a cancer space and hold the uncertainty of what might be under the hood. And we don't always have a lot of control over that, and that can be really hard, especially for those who are in surveillance. There's also a little bit of a part that makes this anxiety harder during surveillance is because we don't know how to plan always. Once you've been through a cancer journey, we sometimes have this reluctance to make our advanced plans because we can be worried about things like recurrence, and scans can really show that type of development. So when we're going in for scans, or we're living in a space where we know every 6 months or every year, whatever that schedule may look like for you, we're going to have to check what's under that hood again. We can feel reluctant to plan the rest of our lives and to be thinking about that future, which can only put us further in an anxious state, especially around scans, because we just don't know what to expect. And so again, the scanxiety is certainly normal during in treatment and in medical surveillance, but we see different intensities because of different reasons here. And again, hopefully providing some context around this will help you understand what might be helpful in mediating your scanxiety moving forward. And Ben, I will kind of toss it back to you to talk about some of the why we need to care about things like anxiety and scanxiety.
Course, thank you. Wanted to give a little disclaimer. This is a potentially discouraging slide, and this is the last slide where we'll be giving sort of context for scanxiety and some background information before we tackle some approaches to actually managing it. I'm sure that's why, if you're watching this, that's what you're most interested in. If you're watching this, you probably already know what scanxiety feels like, even if you don't call it that. The reason I wanted to include this slide is because I wanted to highlight some of the real world impacts of our internal experiences. Sometimes with anxiety and depression and other mental health challenges, there's an instinct to walk it off, to dismiss it, to wait until it goes away. And while that can work sometimes or in small instances, it's not necessarily a good long-term solution. And oh, one moment. And so sorry, I'm just having some technical difficulties. Can everybody still hear me? Is everybody good? Okay,
Yeah.
good. Mackenzie's giving me the thumbs up. I'm sorry. I'm the one who keeps needing IT today. I apologize. As I was saying, uh, just wanted to highlight that there are some real world implications for letting anxiety go unchecked. I also don't want the risks of anxiety to be a source of anxiety itself. I don't want this to be sort of a vicious cycle scenario. Um, uh, these are not guaranteed outcomes. The symptoms on this slide, it doesn't mean that if you experience anxiety, you are absolutely going to experience these things, but you may experience shades of these things. And another point is that it is very rare that your Scanxiety is going completely unchecked. In general, you are usually doing something to help yourself cope with the stress of a situation already. So it would only be in extreme situations where these kinds of symptoms um, would grow to more chronic or larger problems. But I think it is good to just highlight that the things that we feel can have a real world impact on our bodies and our health. So just running through some of those right now. For your cardiovascular health, the physical stress on the heart that is caused by scanxiety can lead to high blood pressure, and if unchecked, can lead to heart disease. Um, for your central nervous system, stress hormones, which are great for priming you for action and for tensing your muscles and getting ready for that fight or flight response. Um, they're not so great when it comes to headaches or dizziness. They can have an effect on weight gain and also depression. Um, Digestion, I'm sure many of you have experienced times where you were stressed about something and you felt it in your gut. You felt stomach pain, maybe nausea, maybe even digestive issues like diarrhea. And again, in extreme situations where you were experiencing chronic, unchecked anxiety, you might see that develop into things like ulcers and IBS. For your immune system, you can experience an increased vulnerability to viral infection. Stress hormones suppress white blood cell activity, which means that your body is less amped and prepared to fend off infections. Um, so, you know, that is an unfortunate side effect of what is hopefully a temporary experience of anxiety. In terms of mental health, anxiety negatively impacts short-term memory. It changes the way that memories are formed, retrieved, in that moment. So you might see it have a impact on your working memory, on your short-term memory. Can also absolutely impact mood. Muscular tension, when you experience anxiety, again, your muscles, they tense. They're getting ready for a potential fight or to get yourself out of there. And that involves tensing of the muscles. And if you are doing that repeatedly, even though it's an involuntary response, you might experience muscle fatigue, which can lead to joint pain, skin pain, muscle aches. And finally, in terms of respiratory health, you might see a worsening of asthma and COPD symptoms due to rapid breathing, which is a common symptom of anxiety. So, with that breakdown, I'm going to pass things back to Mackenzie, and we're going to get to the good stuff, which is what do we do about this? What do we do about anxiety? Take it away.
And just to also add on to Ben's thoughtful point about, that your scanxiety is often not going to go unchecked. I want to emphasize that that's not only something that you're probably meeting already, like Ben said, but also something that, you have a whole care team around you now that's going to be helping you monitor physical and mental health symptoms. And whether or not that means you're involved with social work, you also have your doctors, your nurses, and all the other supportive care here at Dana-Farber to help monitor how you are feeling. So not only are you probably catching these symptoms before they would ever get to a point of some of these more extreme consequences, your care team is also probably going to be able to help you catch them too. So as with everything, we want you to know that you're not doing any of this alone, and that you've got people around you to support you in helping identify how you're feeling and of course what to do about it too. And to dive into what to do about it, we've talked a lot about what scanxiety looks like, and now we're going to talk about how do we stop it? How do we mediate some of those feelings to make them feel either less intense or not there at all? In terms of preparation around your scans, one important part of mediating scanxiety is knowing how do we prepare for it, and bringing a sense of awareness about it into our lives before scan times. This takes a couple of different forms. Few examples for that might be writing down your questions to ask your care teams. For example, like, if my scan says this, what would we do? If my scan says this, what's my other option? What will my scans actually look like? How long do I need to wait for my results? When are you going to call me? These are all really good questions to ask your care team so that you're going into your scans with a sense of more knowledge, more preparation, as opposed to just leaving all of those kind of questions to the wind. We also want to make sure that you're dedicating a space to validate your anxious feelings. As Ben was saying earlier, when we push down mental health symptoms, they often can come back with a force, and they have a negative effect on our mental health and our physical health moving forward. So finding time to make sure you are acknowledging that scanxiety is absolutely real and that it's important to support yourself around it. That space of validation for yourself can be really helpful in actually mediating some of the effects of scanxiety, even though it might still be there. We can acknowledge that. Just simply putting that out into the open and acknowledging that it's okay to have scanxiety can sometimes relieve the pressure that we feel around it, and of course then have better effects on our physical and our mental health moving forward. Thinking logistically here, when possible, try to schedule appointments to fit your preferences, whether that's working around a family schedule, a personal schedule, a work schedule. Doing things that lessen the anxiety of scheduling around your scans can lessen the anxiety overall. So thinking about when possible, talking to your doctors and your scheduling teams about, hey, this is my preference for scheduling scans. I'm a morning person, I'm a night person, and trying to think about how that might be more supportive for you. And then we think about also having some community. When you're feeling stressed, when you're feeling that scanxiety, confirming who can attend appointments with you can be really supportive. Somebody who can wait in the waiting room with you, somebody who can, help transport you home, be that space of conversation or that space of support for you when you're on the front end or the back end of a scan. That can be really helpful in having just a plan for how you're going to approach your scans. That way we know we're trying to control as much as we can about that anxiety feelings. Of course, in the moment when you're actually in the scan, those can be uncomfortable. They can certainly be anxiety inducing. So we have a few strategies for kind of managing anxiety in the moment to help keep you calm and grounded during your actual scan time. One of those is grounding exercises. We think about those as things that bring us closer to our senses often. These can be things like mindful breathing. It can be like the 5, 4, 3, 2, 1 exercise, five things you can hear, 4 things you can see, 3 things you can touch, 2 you can hear, 1 you can smell. Bringing you a sense of awareness around your body that brings you more calm and more back to the present here. We also think about meditation or other mindfulness practices that bring our body and our mind to a state of calm. We have awesome resources here at Dana-Farber that can help you explore that both within the social work department and within our ZACM Center. They can help you explore what does meditation look like. Sometimes we think about meditation as just sitting in a space of silence, but it's actually much deeper than that. It really can be asking yourself questions. It can be in combination with things like breathing exercises or grounding techniques, and really kind of bringing you again back to a space of the present where you're able to feel your emotions and feel your body, but do so in a calmer way. We also think about just the relaxing activities for the waiting room, touching about how when you're in the scan or when you're directly waiting for it, we need things that are gonna bring us to a centered place. Those might be things like distracting games, that might be calming music, or reading something. I was working with a patient who had a book of mantras, and she would bring that to her scans and she would read those mantras to herself before. And that didn't make her scanxiety go away, but it certainly made her come to a space of, okay, I'm more in the present. I know that I'm strong. I know that I can do this. I'm going to be okay. I'm going to come out on the other side of the scan and I'll be able to deal with what comes next. So just reminding yourself of your resiliency, that can be a good space through reading. But these in the moment strategies might help actually quell the anxiety, especially physically, while you're waiting for your scan or you are directly in it. And then we'll kind of come to a space of you're on the other side of that scan. We're thinking about how do we move forward from here, and what are some strategies that we might have for mediating the anxiety that we might feel in the waiting period, between when we get to talk to our doctors about our scan results, or of course, as we think about scans moving forward. It's really important to have a plan for decompression after your scans, and that is going to look really different for everybody. That might look like treating yourself to a nice dinner when you come into the city after a scan. That might be like going home and immediately taking a nap. That might mean like looking or listening to a really distracting podcast in the car ride on the way home. Whatever decompression looks like for you, and again, brings you to that space of kind of calmer physical and mental anxiety symptoms, is really important to do kind of right after your scan. And we can make a plan about that. You can do that yourself or with your loved ones, of course, with the supportive counselings here at Dana, but really just kind of thinking about supporting yourself directly afterwards, right after those times when the scanxiety might have been really hard. We need a place to recenter. And that often brings us to a space of reflection. We can use our anxiety experiences around scans to prepare for our next scans. We would encourage you to take this both as personal reflection and, of course, as needed with professional reflection, with social work or with other supportive services here, that can help you reflect on what was that scan experience really like for me? How did I experience my anxiety in my mind? Did I have any of those mental health symptoms around anxiety? Did I have physical health symptoms? Where did I feel that in my body? How often did I feel that in my body? So that going forward, you might be able to go back to all these preparation and in the moment steps and say, because I felt my scanxiety in this certain way, I know that that grounding technique is going to be helpful for me going forward. Or I know that I didn't prepare enough questions, and I'm going to do that next time I go into my scans with my doctors. And so having a space of reflection after your scans can be really informative, not only in validating your own experience through that scan, but also in helping you prepare for ones going forward. So I hope that these techniques can be helpful for you in just thinking about, what your own scanxiety experiences have been and being able to take some of these tools to the next steps. And then, of course, you might be able to use these in future scanxiety experience as well. But I will go ahead and hand it back to Ben to talk a little bit more.
Just realized I wasn't unmuted. So that's my third strike from the IT department. Apologies, everybody. Mackenzie's doing flawlessly. I think we can all agree.
There's
Um,
limited chances here.
yes, but I've managed to screw them all of mine up. Anyway, so Mackenzie did a wonderful review of techniques to manage anxiety in the moment. Here are just some things you can take with you into your life outside of like appointments, spaces, and the days immediately leading up to a scan or right after. These are just some good proactive approaches to managing anxiety. So, one, you want to maintain your own routines around scans where possible. Now, there are a lot of inconvenient parts of oncology care, and part of the step is accepting the parts of your routine that have to change fundamentally to support your health and recovery. But it also allows you to maintain the important ones that can stay the same. You want to find spaces for normalcy. Um, Cancer brings a lot of unwanted change into your life. You want to take stock of the things and the activities that you can control. You want to own them and you want to prioritize them where possible. Um, Two, movement, walking, exercise. We have the Zachem Center at Dana-Farber, which is a wonderful space to engage in mind-body recovery activities. Movement, no matter what shape it takes, releases endorphins. It reduces the muscle tension, which anxiety tends to create. It can help improve sleep, and it's an opportunity sometimes to spend time in nature, which can be calming. Um, and it also just it supports the maintenance of your stamina, your physical stamina, which I think can help prepare you to endure and recover from and bounce back from the physical stress of treatment and the psychological stress of scanxiety. And I also just want to note, even short bursts of activity is helpful. This doesn't mean that you have to sign up for the next 5K or something. Just like a short walk or a quick jog or some kind of just small space where you're able to use your body after, maybe a, s- s- you know, s- sitting around for a long time, that can be more helpful than you might think. So don't feel like you have to become a triathlete, in order to make this work. Um, Distraction, though it's not a solution by itself, it can still be a part of your coping strategy. You want to put things on your calendar other than just your medical appointments. You want the treatment to support your life. You don't want to live for treatment. If everything that you are planning out is just centering around your treatment and recovery, then that's not going to give your mind any space to breathe. So you want to stay busy, whether that's time with friends and family, work, or hobbies. These things are important, and they are part of the whole picture of keeping you less stressed and more more mentally free. You want to seek support from others, people who are close to you, support groups. We offer support groups at Dana-Farber. All of them are currently offered virtually over Zoom. Um, we're going to be making a pretty specific plug for the social work department in an upcoming slide. But the social work department is an excellent source for psychosocial support, and it can also be a bridge to other services. And Mackenzie will speak to that in the next part. Um, One thing I just want to highlight, that treatment and recovery can often be socially isolating. Sometimes there is less casual contact with the people who you used to see at work or at school or in other walks of life. So it's often on patients to let others know that they need help support, that they could really use that lunch date, that they could really use time to just hang out, play video games, see each other, for a meal, etc. This can feel uncomfortable, but it also creates an opportunity to let other people be a part of your care team, which I know from experience, family and friends appreciate more than you might suspect. Um, and then I just want to speak to a couple specific treatment modalities. One is cognitive behavioral therapy, and it's a type of psychotherapy um, with an objective to identify and challenge unhelpful thoughts, learn practical self-help strategies, and modify behavior. I wanted to highlight this one specifically. There are a lot of fantastic treatment modalities out there, but this one has a lot of research attached to it. It is often short term. It can be done, in 6 to 20 sessions, or it can be, sprinkled into all future sessions based on your preference. It can be provided by a social worker, psychologist, or most other types of mental health counselors. And it's just a philosophy that this institute really stands by. So while you can certainly Google CBT and coping strategies, I think it's often most effective when you are partnering with a mental health counselor, no matter who they are, whether it's with us or whether it's with someone in your community. It just might be something to explore. And finally, narrative therapies and journaling. Um, this is another way that you can access support, again, either with a counselor or on your own. For narrative therapy, it's a collaborative, non-blaming type of psychotherapy where the patient and therapist work together to reframe or reauthor the challenges in a person's life. It views problems as separate from the client. It assumes that clients have the capacity to change their relationship with problems like anxiety, and it's very empowering. It's a very positive space for therapy. Journaling, I think everybody here is familiar with the concept of journaling. It's very personal. It helps get stressors on paper, which can help with rumination. And it's an opportunity to help examine and challenge stressors and different scenarios, generate different possibilities. You can write like, well, this might happen, but also you can challenge yourself to think, well, maybe this will happen. And so there's a lot of opportunity there to expand um, your scope on what our future scan is going to bring. Okay, and I'm gonna hand things back to Mackenzie because I think we're already at the 45-minute mark, and we have a few more slides to go through. So, thanks.
Here's your social work plug that Ben was mentioning. So social work can be an important space to help explore some of the scanxiety or other mental health symptoms that you might be having as you navigate cancer care. We offer here at Dana social work supportive counseling for anxiety during your cancer journey. This often takes a very talk therapy based model, which is kind of exploring your thoughts and feelings around your cancer through what we hope to be a very inviting conversation-based, like that narrative therapy Ben was talking about, approach, one that makes you feel welcomed and not judged as you explore your different emotions and how you might be feeling during cancer. That can sometimes look like just conversation. We can also translate that into coping skills and resource connection for you, whether that is through concrete skills or other services that might be helpful. We do this often through in-person or remote connection. We try to be very flexible. During in-person, that might mean coming to a private room to have a visit with your social worker. We can meet you in infusion. We can meet you in other spaces around the Institute, and we try to be as flexible as possible. And then remote, we can offer options over phone and Zoom. Zoom for our in-state Massachusetts patients and phone for our out-of-state patients. We do all of this through very flexible scheduling, trying to offer regular or as needed appointments. Your social worker can talk more specifically with you about a schedule that works best for both of you and what might be most supportive moving forward. But that's kind of the individual counseling level. We also offer, as Ben mentioned, support groups here. These are both targeted for in-treatment and surveillance patients. And we offer those, community organizations offer those. So whether or not you're finding that support group in Dana-Farber or outside of it, this can be a really wonderful space to have community around your experience, to be with people who understand your experience a bit more, and really can offer very lived experience advice for you. Can be really normalizing, very validating to sit in a space where people know where you're coming from, and giving you that kind of concrete advice. Briefly mentioned this before, but we can do some resource referrals. This looks like assistance connecting with other specialists at Dana-Farber or those in the community that might be additionally supportive for you. That might be a psychologist, someone to explore on a deeper level, psychiatry if you're looking for medication management options, nutrition for thinking about how your diet and your nutrition can overall support your body and your mind as you navigate cancer treatment. Mind-body health specialists that really bring us to a space of understanding the connection between our mental and our physical health. And then other concrete resources such as financial, transportation, things like that, that we both have sometimes resources within Dana-Farber for, but would also be helpful in some ways to partner with you to connect in the community as well. As far as getting connected with social work, we're pretty easy to reach. You're more than welcome to ask any of your care team members, whether that's your doctor, your nurses, your infusion nurses, or any of these other specialists at Dana-Farber for a referral to social work, which they can enter in our system and we follow up on automatically. You can also always self-refer. So if you're hearing something that you would like to further explore in today's presentation, and you just want to reach out yourself directly, our number is on the screen there. It's 617-632-3301. All of this information is published on the Dana-Farber website if you just Googled social work at Dana-Farber. And then you can always, again, talk to your care teams more if you'd like more info. But that's a little bit about how you can get plugged in with social work. I think we're going to hop to a slide that hopefully will cover some of the questions that some of you might have. And then, again, would always recommend connecting further with the supportive services here if you have more. As far as some of these beginning frequently asked questions, the first one, and Ben touched on this a little bit earlier, which is, should I tell my loved ones how I'm feeling? And, everyone has a different relationship with their loved ones, and it's important to explore what that relationship does look like for you, if it's supportive or not in certain ways. But very generally here, our loved ones can be a really important resource for us during cancer treatment, and letting them in on how you're feeling, letting them know, hey, I'm experiencing anxiety around this scan, or I'm worried about what this scan might mean for me. I'm feeling physically or mentally unwell around this scan. Letting them know how you're feeling gives them a chance to better understand what your experience is like so they know how to help you moving forward. And as Ben mentioned, I know that sometimes that can feel like a burden to ask your loved ones and to be responsible for telling them or asking them what you need. But we know that it can be a really good starting place, and gives your loved ones the opportunity to show up for you in some really concrete and important ways as you move forward through treatment. Also, the kind of question of what will my scan be like? Every scan is different, and different cancers will necessitate different types of scans here. So at the end of the day, we would encourage you, of course, to talk with your doctors or your imaging staff about what an actual scan will look like. But some helpful questions to guide that might be, how long will my scan be? What will the actual machine look like? Will it be enclosed? Will it be open? Do I have options around that? Will I feel anything? Will my scan cause me to feel anything physically? For example, I work primarily with breast oncology patients, and when they go through mammograms, we know that to be a very uncomfortable scan. And so having some information about what your scan might actually look like are important questions for your providers. And then we also kind of wanted to touch on what can be somewhat of a niche experience, which is how can I manage my anxiety as a metastatic patient, someone who may be in treatment indefinitely and be getting scans indefinitely as well. And around that, we would definitely recognize that a lot of what we've talked about today does still apply even to our metastatic patients. But you also may feel more of a blend of all of this. I know when we kind of thinking back to that in treatment versus surveillance slide, we kind of presented those as almost two separate experiences. Metastatic often falls somewhere right there in the middle. You're kind of indefinitely in treatment. You're also getting scans. Sometimes those are more frequently, sometimes those are less. And so you really do have a very unique experience as a cancer patient. So we want to normalize that. While these strategies can still be helpful, absolutely, in managing your scan anxiety, we do so with the recognition that you might be feeling the intensity in different ways than your other cancer peers. And so I think that's something important to explore with yourself, and of course with counseling support as it feels helpful, to understand how the unique metastatic perspective might contribute in different ways to the intensity of your scan anxiety, even though you can always fall back on these strategies no matter where you're at. I'll hand it to Ben for the next three, and then we'll kind of do a little wrap up from there.
Thanks, Mackenzie. This next question, what can help me manage anxiety during the scan itself? So just to hone in on some specific tools for your tool belt when you were in the moment, when the scan is right there. What are some things that you will have reasonable space to do that won't take up too much time or resources or planning, things you can do in the moment. There's deep breathing, which often involves slow, deep breaths in through the nose and out through the mouth, focusing on the sensation of the lungs expanding and contracting. If you're looking for more specific breathing exercises, I would suggest connecting with social work at the Zachem Center or Google it. There's a million of them. Two, there's guided imagery. There's visualizing yourself in a peaceful place while focusing on the sights, sounds, and smells of that place. It's kind of a exercise for your imagination, and it can help take you out of a place that feels uncomfortable or a state of mind that feels uncomfortable, like feeling anxiety. Calming music, sometimes this is offered by your technician. Sometimes that's an option based on the type of scan and what's possible. Sometimes they themselves are able to let you pick music or put on a radio station. Other times there are opportunities for you to bring your own. I have worked with people who ride into Dana-Farber with like Viking music playing and really like kick butt, like heck yes kind of stuff. And then I have others who are looking for more of a calming experience when it comes to music, something that is soothing. Um, uh, both options are great. A mix of them is best. I would say also communicate with your technician to better understand the scan process, kind of like Mackenzie said, and request adjustments where possible to make the scan more comfortable for you or to improve your understanding of the process. Um, Mindfulness meditation. Mindfulness is a buzzword that gets used a lot, but it gets used a lot because it's effective. And mindfulness meditation refers to paying attention to your breath, bodily sensations, just everything that's going on with your body without judgment, just kind of taking stock of all these things and cataloging them and reviewing them. And that in it of itself can be really useful. And also for our claustrophobic patients, sometimes open MRI machines are an option. Sometimes earplugs for loud scan machines and sedatives such as Ativan can help dampen the stimuli that fuel anxiety and are things to discuss with your medical team. Um, Next, can anxiety be cured? Unfortunately, no. You know, the anxiety response is too ingrained in us, and we still need it to prime us for potential threats and focus our attention on, the task at hand. That doesn't mean that we can't turn the volume down or train our bodies to react in more adaptive ways. Your scans and health are worthy of anxiety because they're important. It's unfortunately, it makes sense for why people experience anxiety. It would be strange if people didn't. But that doesn't mean that has to be intrusive. That doesn't mean that it has to result in a spiral that leaves you in a worse place for functioning. Um, and lastly, with this question, will challenging emotions like anxiety impact the success of my treatment? I get this one a lot, where people are concerned that they are negatively affecting the effectiveness of their treatment because they're stressed or they're depressed or they have a negative mind state. There's no direct evidence that anxiety or anxiety itself will impact treatment success. There's a greater chance that it will indirectly impact treatment. Like, let's say if you're so anxious, you purposely miss appointments, or you're not sleeping well due to anxiety, or you're not eating well, and these things are impacting your body's physical health and their ability to bounce back from treatment. Um, I sometimes see patients get stuck in a vicious cycle where they are stressed about feeling stressed, and that can be maddening. I think I just want to clear the air and say it is unlikely that you can remove all anxiety from the equation, and uh, don't see anxiety or anxiety as a failure. Just experience it, let it wash over you, manage it the way that you best can, and move forward. Easier said than done sometimes, but I think that is the goal to reach for rather than eradicating it. Um, just some closing thoughts. I know we're almost out of time, but as you proceed with treatment and recovery, the effectiveness of different strategies may change over time. Try new ideas and revisit old ones. You might not have been in the right headspace for one to work, or one might not have been as applicable or as accessible before, and now it is. So mix it up. Don't be afraid to go back and try different things or try old things again. Um, Anxiety is not a negative or positive emotion. It is adaptive in some situations and painful in others. And our goal is just um, to de-emphasize the negative aspects of anxiety. We want to partner with you in doing that. Don't try to stamp out anxiety. Instead, learn how it affects you, anticipate it, and make a game plan around it. That's a lot of what this presentation has been about. And finally, don't hold heavy emotions alone. Sharing your feelings will make them feel lighter. And then one final thing I just want to say is that, scans are just a way for your medical team to get more information to treat you better. That's the goal. So, whatever the results of your scan may be, it's just going to help us care for you in the best way possible. And I hope I hope that you can leave with the positive, message of that thought. So
I really wanted to thank you both for coming on today. That was a super informative presentation, and I think it'll be very helpful to the folks that get to watch it. As I mentioned earlier, that this session was recorded and it will be posted eventually on our Blum YouTube playlist and our Blum Digital Resource Center. 4 questions that came through, and again, we invite everyone to submit any questions that they might have. We did have a comment earlier thanking you guys for this presentation, which is great. They wrote, the analogy I think of with Scanxiety is Russian roulette. I feel like I'm doing this thing to myself and can end in terrible or nothing at all. So kind of just talking about the toss up between the emotions that they feel. There is an interesting trade-off between delaying and knowing and having knowledge and acting on it. Just an interesting trade-off on working with our care teams and figuring out the frequency of scans.
Absolutely.
Somebody wrote, how can my loved one support me through Scanxiety?
I think, as we hinted at, the importance of bringing in your loved ones is definitely something to focus on as you move through your cancer journey. One of the first things that social work will help you assess is who's in your support system, who's going to be there for you. So it is definitely very important. But when we think about the nitty-gritty of how our loved ones can actually provide support, there's a lot of ways that they can do that. If I were thinking about two ways, it would be like both the emotional and the practical things. So for Scanxiety around practical, that might mean like they can bring a bag of comfort items for you when you go for your scan. We kind of touched on earlier, making that game plan of who's going to bring you to your scan appointments, who's going to be with you. So we could think about, okay, is that person holding comfort items for you? Are they going to be at the ready for you when you're done with your iPod, with your Viking music to ride out from Dana-Farber? Or can they be prepared around your routine? Can they make sure that they're going to be the one to drive you home because you might need a little bit of time of decompression? That might mean like when you get home, maybe your support person is going to be taking around some more responsibility of the home care, the child care, the meal prep, or something like that day because you might again need that space of decompression. So those can be like just some very off the top of my head practical ways that your loved ones can show up. And then emotionally, I think it can be very helpful to receive those words of affirmation from our loved ones of, I'm going to be here for you. Yeah, we're going to tackle this together. You're strong. Those words of affirmation can be really meaningful. They can also be there for you in terms of encouraging you to take space for your anxiety. We mentioned that as a helpful space of preparation is not pushing down anxiety, but recognizing that when a scan is coming up, those feelings absolutely are very normal, and taking some space to actually sit with those and validate those for yourself. We don't always do that automatically for ourselves and our partners, our loved ones, and they can be a helpful space of reminder for, hey, how are you feeling today? Take what time you need to process this scan that's coming up. They can be reminding for us that it's okay to spend time with our emotions. So those are a couple ways I think about like the very emotional and practical ways that our loved ones can show up for us. And there are plenty of resources for caregivers who might be navigating a cancer diagnosis alongside you. We've got a caregiver support group here. There's plenty of online communities for caregiver support that can help them also find these ways to support you. But if you were ever having a conversation with your loved ones about what that care actually looks like, I would say that's a couple of concrete ways. Ben, I don't know if you have anything to add or.
I would just add for family and friends and caregivers supporting patients, while respecting patient boundaries, I would encourage you to make periodic opportunities for spending time together to initiate contact, whether it's on the phone or in person, virtually, etc. As I noted in an earlier slide, it's often up to the patient to ask for support, to ask for people to kind of come in and help them, sort of share the load of all of this. And just a reminder to if you have someone in your life who is going through this, it can be a little intimidating or it can feel exhausting to do that. Sometimes patients worry that they are taking time away from somebody's schedule when they do that. So I would just encourage you to periodically, make yourself available to initiate that contact, to make that invitation in a way that feels naturalistic, and I think that they even if they aren't always available for that contact, I think just keeping the lines of communication open is important. So that's what I would say.
Thank you both so much. I don't think we have any other questions, but again, that was a fabulous presentation. So thanks for joining us today.
Well, thank
Yeah.
you so much. Oh, sorry. Saying thank you so much for inviting us, and it was a pleasure. And please let us know if we can help support your viewers or group participants with any follow-up questions.
Great. And people are writing thank you into the chat. So
You're
Thank you all
welcome.
for joining and having us.
awesome. Take care, everyone.
Bye.